Hey there, future nurse. Let's talk about some of the common nursing interventions you might get tested on the NCLEX when administering diuretics. There are 3 things that you need to monitor as a registered nurse when giving diuretics, and I use the acronym VFE. V stands for vitals, and the most important vital sign that you need to assess is blood pressure. The mechanism of action of diuretics is to excrete fluid from within the body, and when we have that drop in fluid from inside the body, we can also see hypotension. It is essential in the NCLEX that you assess for orthostatic blood pressure. This is when there is a drop in blood pressure with the change of positions, and since we're excreting fluid with diuretics, the patient is at risk for this. F stands for fluid. So fluids include intake and output. Okay, we want to make sure that if we're administering a diuretic, we are getting a therapeutic response with the output. And additionally, very important on the NCLEX is daily weights when you're assessing fluid. We want to make sure that this patient isn't retaining more fluid than we are excreting. And lastly, we have electrolytes. The 2 most important electrolytes when giving a diuretic is potassium and sodium. And this is so important because hypokalemia places an individual at risk for a cardiac arrhythmia. Lastly, sodium is also important to monitor because remember, sodium swells. So wherever sodium goes, water goes. So if I have a patient with fluid overload, I'm going to encourage that they have a low sodium diet. All right, I hope you learned something from this. Follow for more.